Okay, so let's talk about the postoperative chest, but now let's talk about the complication of surgical procedures that can be identified radiologically, if you want to call it, or something like this. So we will talk about mediastinoscopy when you are looking to the mediastinum throughout, let's call it a tube, bronchoscopy that you are inserting, let's call it a tube throughout your mouth, mediastinoscopy you are putting throughout your throat, let's say, throughout the trachea or throughout this area and looking on the mediastinum. Bronchoscopy from here to the trachea to the lungs, and mediastinoscopy you're looking to the mediastinum. Wedge resection is another operation or procedure that you will look on the complication. Median sternotomy, that is used, for example, to open the chest, uh, heart diseases, to treat heart diseases, replace uh, forgot the name, valves in the heart, or I don't know, cabbage, or take biopsy now, or doing surgical procedure on the lungs. And another procedure that we'll talk about is the chest tube placement. So let's start with the complications of each. So mediastinoscopy, if we're doing it and looking on the mediastinum, what we can have complications. The rate of the complication is, let's call it low, below 2%. And what we can have is mediastinal bleeding, bleeding from the mediastinum, pneumothorax, and damage to the vocal cords, so vocal cord paralysis, because we may damage the recurrent laryngeal nerve, so we can uh, make damage to this nerve like it happens in thyroid, thyroid surgical procedures that may have recurrent laryngeal nerve damage. So here as well, we can have cord paralysis, vocal cord paralysis, as a result of laryngeal nerve, recurrent laryngeal nerve damage. So, mediastinal bleeding, pneumothorax, and vocal cords paralysis, those are the complications that may arise from mediastinoscopy, but the rate is less than 2%. The next thing is bronchoscopy. So, in bronchoscopy, we are inserting the bronchoscope throughout your mouth, so teeth injury and aspiration may be a consequence of inserting something like this into your mouth. Transient pulmonary opacity is a result of what we're doing in the lungs. Fever, if it entered some infection or something. A tracheobronchial biopsy can cause pneumothorax. We are doing needles, and hemorrhage, 1% for the hemorrhage. So bronchoscopy, the complication depends if we did something that is procedural, like biopsy, transbronchial biopsy, or not. And with resection, we are taking like a slice that is like a wedge from the lung, for example, for small tumor with normal and healthy tissue around it. Uh, the complication may be air leaks, which is quite common, contusion, and if the excision was not enough or not good enough, or the tumor already spread, so recurrence of the tumor may be a complication of wedge resection. The other procedure we are going to talk about is the median sternotomy complications. Again, median sternotomy, we are going to the sternum and cut it open and open the chest in order to do procedure inside the chest. For example, heart procedure, cabbage, for example, replacement of valves in the heart, for example, surgical procedure for the lungs. Those are the, let's call it, purposes of the median sternotomy. And the complications, which rate from 1% to 5%, so let's call it rare, are a hemorrhage in the mediastinum, inflammation of the mediastinum, mediastinitis, which may be with vocal fluid collection, sternal dehiscence because we need to suture the sternum, but it can just dehiscence, so it may be a complication. Forced aneurysm, I'm not sure which aneurysm, but aneurysm of what they mean, but this they also call it as another complication. Forced aneurysm, you can also call it as pseudoaneurysm. Remember the difference between true aneurysm and false aneurysm, pseudoaneurysm. True aneurysm is that when we're talking about a blood vessel, there are three layers, and when there is an aneurysm, if it's a true aneurysm, we are talking about an aneurysm that is built from the three layers of the blood vessel. Right, three, right? And in pseudoaneurysm, we are talking about hematoma, for example, because of the, I don't know, tearing in the endothelial layer and accumulation of blood without cover of the three layers. So because the aneurysm is not covered by the three layers, it is called false aneurysm or pseudoaneurysm. Phrenic nerve, we may damage the phrenic nerve and cause phrenic nerve paralysis. Now phrenic nerve is important for example, for the movement of the diaphragm, so it may have breathing problems or moving the diaphragm problems, so maybe this. And osteomyelitis of the sternum, infection of this bone. Chest tube placement, this can also have complications. So we may have Horner syndrome. Remember that Horner syndrome is damage to the sympathetic nerve fibers, and when we have it, we have the triad or quadrat of ptosis, meiosis, anhidrosis, and enophthalmos, I think. Those are the main things that are seen with Horner. Ptosis, meiosis. Ptosis, the eyelid is like falling. Meiosis, the iris becomes little because the sympathetic nervous system is shut down for the eye, so the iris becomes smaller. Anhidrosis, no sweating in this area. The sympathetic nervous system is important for doing this hydrosis. And I think enophthalmos or exophthalmos, I'm not sure, so I won't make you not correct. I can look for it in Horner syndrome, but I won't be able now, so I won't do it now. But it's one of the two. So Horner syndrome can be a complication of a chest tube insertion because there may be pressure on the sympathetic ganglion in this area. And again, false aortic aneurysm. Wait, it's very interesting to see. Yes. Okay, false aortic aneurysm, namely aneurysm in the aorta that is false, as we said, pseudoaneurysm without all the three layers of the vessel encapsulating the aneurysm, so it's a false aneurysm or pseudoaneurysm. So we talked about the main procedures and the complication: mediastinoscopy with bleeding, pneumothorax, and vocal cord paralysis from recurrent laryngeal nerve damage, bronchoscopy, teeth injury, aspiration, pulmonary opacities, fever, and when you are doing biopsy, hemothorax and hemorrhage. In wedge resection, there is air leak, contusion, and there may be recurrence of tumor if it's not enough. Median sternotomy complications. So remember that we are doing median sternotomy. So the complication in the bone will be osteomyelitis, dehiscence after your suture, and a hemorrhage in the mediastinum, mediastinitis with fluid collection, aneurysms if you are touching the vessels, phrenic nerve paralysis, which is important from the movement of the diaphragm, and osteomyelitis of the sternum, infection of the sternum, as we can say it. Chest tube placement, it can cause damage to the sympathetic plexus, so Horner syndrome, and it can also cause aneurysm, but again a false aneurysm, a pseudo aneurysm, without all the three layers covering the aneurysm, so it's pseudo false aneurysm. Thank you very much. This was about complication of surgical procedure in the postoperative chest in a radiographic, let's say, a point of view, and very shortly in it. Thank you very much. If there are any mistakes or corrections, please tell me, and that's it.